Are you missing a front tooth and a dental implant isn't an option, but you don't like the idea of having a removable bridge? Well, a Monodont Bridge might be the perfect solution for you. A Monodont Bridge is a permanent tooth replacement which gets attached to the teeth on either side of the space. It replaces the missing tooth without the need for dental implant surgery or having to deal with a removable partial denture. The monodont consists of a false tooth made out of composite resin, the same material that is used for dental bondings. On a metal framework, the ends of the framework are bonded into the teeth on either side of the space with more bonding material. The preps in the teeth are very small, but they hold the monodont bridge in place very securely. This is much more conservative than a traditional three-tooth fixed bridge where the teeth on either side of the space need to be trimmed down for crowns. And the bridge only takes 2 simple visits to place. Check out my How to Make a Monodont Bridge video to see the steps involved in making a monodont bridge. I usually use the monodont bridge to replace an upper lateral incisor or a lower incisor for patients who can't or don't want to get a dental implant, and they also don't want to wear a removable bridge. You may have heard of another type of bridge similar to the monodont bridge called a Maryland bridge. It uses 2 wings that are bonded to the teeth on either side. While it is conservative, it also has a reputation for coming unbonded. When I first bought my dental practice, the previous dentist had placed a lot of Maryland bridges. He even used them to replace missing back teeth. I had to replace all of them since they all fell out eventually. Knock on wood, since I've been using the monodont bridge, they stay in place much better than Maryland bridges. Since the false tooth of the Maryland bridge is made out of composite resin material, if you ever chip it or if your gum under the false tooth shrinks a bit, it can be repaired in your mouth. Cost-wise, a monodont bridge is about half the cost of a traditional 3-unit fixed bridge. And if you ever decide to get a dental implant in the future, the monodont bridge can be removed easily, and the only lasting effects of it will be the 2 small composite resin fillings where it was attached to the teeth. Does anybody watching have a monodont bridge? What do you think of it? Let me know in the comments below. Thank you very much for watching, and I'll see you in the next video.